Hello, I'm Dr. Ryan Kazemi, an oral and maxillofacial surgeon here in Bethesda, Maryland. Today I would like to discuss a common condition that is often discovered during a routine dental exam and x-rays, which may present itself with absolutely no symptoms. It often appears on a dental x-ray as a dark and somewhat circular area, which is known as radiolucency, and it could happen either adjacent or in close proximity to the adjacent teeth. The radiolucency, or that darkness, is due to the loss of calcification and bone in the area, and it is loosely referred to as a cyst. Now, such lesions may be either inflammatory, such as an abscess, they may be cystic, or may also be a malignant tumor. So it is important to manage it as soon as possible. Now, the first step is to fully assess the size and the position with a three-dimensional cone beam CT scan. The 360 view provides vital information on the type of lesion, its size, and also the proximity to adjacent teeth and other vital structures, such as nerves or sinus cavities. If the lesion is in intimate contact with the adjacent teeth, either on the side or at the root tip or the apex, the next step is to get an endodontic consultation to assess the vitality of the tooth. Now, periapical cysts are common findings with non-vital teeth, and they can respond quite well to root canal or endodontic therapy with or without a surgical removal of the lesion. However, such lesions may also be odontogenic cysts, which can grow relatively rapidly and compromise the jawbone and the adjacent teeth. So a complete removal and biopsy of the cystic lesion is a must to establish a definitive diagnosis. Let's take a look at this patient who was discovered with such a presentation during a routine dental exam. The patient's dentist noted a round, dark area between the upper lateral incisor and the canine and referred the patient to us for evaluation. So we did a cone beam CT scan, which demonstrated a unilocular cystic lesion measuring about 5 to 6 millimeters in diameter. Patient was completely unaware and asymptomatic and had no abnormalities clinically. Next, patient was referred to an endodontist for evaluation of the adjacent teeth, and both of those teeth showed no sensitivity to thermal testing, therefore indicating that they had necrotic pulps. However, as it was noted by the endodontist, the lesion did not correlate with the necrotic state of the teeth, and hence a exploration and a biopsy was mutually recommended. The root canal therapies were completed on the adjacent teeth, and the patient was then referred back to us for surgical removal and biopsy. So clinically, the location of the cyst was noted as it was measured from the cone beam CT scan. Under local anesthesia, a small incision was created in the gum tissue, and a very conservative flap was raised over the cystic lesion. The cyst was then identified and curated completely. A yellowish content was noted to come out of the cyst, which was removed along with the cystic lining, which is a soft tissue material. The cyst was then curated aggressively to remove all the soft tissue lining and also a thin layer of the bone, and then it was irrigated and cleaned completely. The cyst material was sent for biopsy. Since the defect was close to the adjacent teeth, it was also grafted using allogenic bone, and it was covered with a resorbable membrane. The incision was then closed with a resorbable suture. The biopsy confirmed a diagnosis of odontogenic keratocyst, also known as OKC. These lesions are benign However, they do have a higher rates of recurrence. So it's very important to monitor the site with a cone beam CT scan at 6 months, 1 year, and then again in 2 years to check and make sure that it has not recurred. So here are the key points to keep in mind if your dentist discovers dark areas around your teeth or in a jawbone. First, have it checked out as soon as possible. It's not a good idea to keep an eye on it, so see your oral surgeon for a cone beam CT scan and an initial assessment. See your endodontist for a proper assessment of the adjacent teeth. A close collaboration and communication between the doctors is critical. Cystic lesions must be removed and biopsied for definitive diagnosis. And a close follow-up and a post-treatment imaging is vital to make sure its stability and its continued health.